Welcome to Stories of Impact. I'm your host, writer Tavia Gilbert, and along with journalist Richard Sergey, every first and third Tuesday of the month, we share conversations about the art and science of human flourishing. Over our last couple of episodes, we told the story of decades of positive transformation the nation of Rwanda has sustained since the catastrophic 1994 genocide against the Tutsis. We learned that Rwanda's peacemakers have for decades nurtured a culture of reconciliation and resilience, cultivating communities where citizens flourish. Deep healing and renewal like that can come only after conflict ends. It can't happen in the midst of war. In order for children, families, and elders to have a real chance to recover from trauma, in body and soul, violence has to cease. But the reality is today, hundreds of millions of people live in the midst of ongoing conflicts, and their mental and physical health are undermined by the indiscriminate brutality of wars that may not end anytime soon. Our guest today, Dr. Mark Jordans, is a professor of global mental health at the University of Amsterdam and King's College London, and director of research and development at War Child, which for 30 years has worked to care for children affected by wars. He is not waiting for peace, but instead is committed to doing everything he can to help children caught in the middle of violence cope with the crises they face. Here's Dr. Jordans.
We're talking about 460 million children and more globally that are affected by armed conflict. 460 million is hard to grasp, but it's almost, just to give you a sense of it, it's almost 1 out of 10 children globally that are growing up in situations that are affected by conflict.
Dr. Jordans cites the reporting of organizations such as Save the Children International and the Heidelberg Institute for International Conflict Research, which meticulously counts the state of warfare in the world and its impact on an annual basis, and substantiates that astonishing number of children affected by war. Dr. Jordans' research is focused on answering the question,
how do we still promote the mental health and reduce the impact of conflict and war on children's mental health? Children are suffering. Children are actually suffering from mental health problems at a scale that is much bigger than we thought before. And if there's anything that we can do to reduce that suffering is, I think, what makes me tick. But especially, I am keen to use research as a way to improve the care that children are receiving and use research as a way to improve their mental health, to improve their well-being, and use that as a tool, as an instrument to improve their lives, even if it's a little bit.
In January 2024, War Child officially added Alliance to its name to highlight the growing global partnerships united in the shared belief that no child should be a part of war, ever.
So War Child is a non-governmental organization that operates in 14 countries, and in countries where war is actually now taking place or has taken place. So it's essentially a humanitarian organization and offering services in these 14 plus countries to improve the mental health, to address child protection concerns, to improve the education settings. We know that because of conflict, education is interrupted or the quality is deteriorated of education. So we also want to intervene in that aspect of how conflict impacts well-being. If we want these generations that are growing up in conflict to be able to bounce back, to be resilient, their education needs to be as good as possible, even in those adverse contexts. Also, we know that there's a higher risk of child abuse or neglect in situations of conflict. Those type of conflicts also increase the risk of other types of conflict. For example, conflict within the family setting, conflicts between peers in schools. But those are very much kind of manifestations of the larger conflicts. And again, we want to intervene in that pathway.
Humanitarian responses to those caught in conflict have not historically prioritized addressing the psychological impact of war. Dr. Jordans wants to change that.
I think before, we're coming from a setting where humanitarian aid was primarily focused with making sure that people had a roof over their head, making sure that they have food, and making sure that there's very basic health service in place. And those are absolutely the priorities. But what was essentially neglected for a long time is that there's also a lot of mental health suffering that goes along with these humanitarian contexts such as war, and that we need to address these for the well-being and development of children and equally of adults. I think it was for the longest time seen as kind of this luxury thing, like, that's something that you can get to, if you live in a high income setting and everything else is fine, then you can go to a psychotherapist and have the luxury of that being addressed. I don't think it was seen as something that was a primary need. I think it's a mistake to say we can only get to the mental health until those conditions and those needs are met. What is now being advocated and also being implemented more and more commonly is to say those mental health needs can and should be addressed simultaneously and as part of addressing issues such as nutrition, such as shelter, and other issues. They're not distinct, they're not sequential, but actually part and parcel of what is considered to be adequate response in humanitarian settings.
Tools developed by War Child are what Dr. Jordans refers to as interventions, and they're designed to promote and improve children's mental health and well-being, promote child protection, and improve the access to and quality of education. One such intervention is called Team Up, which is focused on themes like developing friendships, reducing stress, and dealing with fear. Team Up includes adapted versions of games like tag or relay, activities that make it easier for children to engage.
Team Up is rather unique is that it's a largely non-verbal and largely movement-based intervention that aims ultimately to improve issues of social connectedness among children that are participating by improving the well-being of children participating. And it's doing that through games, through play activities, movement activities. So it's very much a very active way of engaging children. And they do that within Team Up in a very structured setting. So every session would have 3 parts with an opening, a middle, and a closure. And each part would have certain activities, movement activities or games or play activities that fit that open, middle, or closure part of the intervention.
Part of the success of the Team Up intervention is that it involves both the mind and the body, and that it can be offered in a variety of locations.
I think we've compartmentalized things far too much. Things had to be in a particular box for it to be addressed. And I think we can provide better care if we open up some of those boxes. And one of them is exactly right, is by not making that solid distinction between the mind and the body, but by bringing those together. I think that's one of the things where Team Up really stands apart from many of the other psychological interventions that are out there, is by bringing some of those more psychological and psychosocial aspects together with a focus on the body and on movement. And that is exactly, I think, one of the beauties of Team Up. Team Up is a beautiful example of an intervention that can be easily implemented in multiple community settings. So schools lend themselves extremely well. That's where children are. It's a good platform because you need space. So schools is definitely the most logical place. And also schools are often and teachers are often very happy and excited to have interventions such as Team Up implemented in their place. But it doesn't need to be in schools. It could also be other settings within, for example, a refugee context or other community centers.
In fact, Team Up was developed in a refugee setting by a diverse team of experts.
And that was done by a group of professionals that include dance and movement therapists, that is really looking at specifically those nonverbal and body-focused interventions, to psychologists and child psychologists looking very much at the mental health aspects of the work. There's anthropologists involved, so it really has a multidisciplinary team that is involved at the development stage but later on also in the research stage. It was actually developed to respond in the Netherlands when we got a large influx of Syrian refugees in the Netherlands, so much so that there was emergency shelters being developed, and we were able to tap into and use a lot of the experience that we had in working with children in many of the war-affected countries where War Child is active.
War Child has research infrastructure and collaborations in Uganda, Burundi, Colombia, South Sudan, Lebanon, Jordan, and elsewhere. And their studies show the prevalence of depression, anxiety, and post-traumatic stress in adults and children who have suffered from war. Experts are already aware that suicide is among the leading causes of death among those young people. That's why there is urgency for researchers like Dr. Jordan's to measure the impact of interventions like Team Up, which will help prove the value of those tools. In a recent study of Team Up in Uganda, he says,
we were able to demonstrate that 550 children, or a little bit more, were divided over Team Up and control group, randomly allocated, and we then followed up the outcomes before and after. And we were able to show that children participating in Team Up had significantly better outcomes in terms of well-being, had significantly better outcomes in self-reported social connectedness. They had markedly reduction in traumatic stress compared to that control group. So really demonstrating that Team Up was achieving the results we had hypothesized. Then we were also able to demonstrate that even 6 months later, those results were still maintained in a Team Up group and still better than the control group. So not just did we see immediate effects, but those effects were also maintained over time, which is quite uncommon to be able to demonstrate.
The positive findings of the Team Up research are key to advancing Dr. Jordan's mission to relieve the suffering of millions of children across the globe.
Now, how can we make sure that we scale up these interventions? We are still faced with too many small projects implementing mental health interventions rather than really large-scale interventions to reach millions of children. If there's 460 million children affected by armed conflict one way or the other, little projects are not enough. So yes, there's a critical need. The way we unpack this is by first having an evidence-based intervention so that you can really say, look, we know that this intervention works, and to replicate that effectiveness study in multiple settings so that you really know we are confident that this intervention is effective. And that makes a lot of sense, yet there's still a lot of practice in our sector that is not evidence-based. So I'm saying that is the starting point, is really to say we have an evidence-based. But then we go on and we have now, as War Child, a whole department that has been started up to support this scaling of evidence-based intervention, because it really means developing partnerships with organizations that can take up this intervention to really make sure that there's sufficient guidance on how to implement this intervention, how to adapt it to new cultural context. How do you go about maintaining the quality of the intervention when it is implemented at scale? And how do you go about monitoring that quality and even using that monitoring of the quality to make changes when the quality is not enough? So that whole framework is being developed and used in order to implement and scale up interventions such as Team Up, which is now, for example, being implemented, I think, in over 26 countries as we speak. So it really is already being taken up quite widely.
Dr. Jordan's and his colleagues hope that by developing innovative tools designed to address the overwhelming needs of children, families, and communities impacted by conflicts, they may be able to prevent serious problems before they happen.
You have mental health treatments in order to reduce symptoms for children that have already developed something like depression or anxiety. On the other hand, you have mental health promotion, which is essentially aiming to improve positive aspects of mental health. And so, for example, by improving well-being or by improving friendships or increasing friendships and social connections. And The idea of what we call mental health promotion interventions is that you, by increasing those positive aspects of mental health, and thereby hopefully children do not even develop the mental health problems and conditions in the first place. And that becomes a buffer and a protection against the adversity that they're dealing with.
However, the funding for any such interventions is lagging, says Dr. Jordans.
When you speak to donors, when you speak to, when governments come together, there is the acknowledgement about the importance. There is now an annual summit, interministerial government summit on mental health globally. So it really is being discussed at quite high government and policy levels, but it's just not translating yet into large investments.
So he offers another argument supporting the impact of this work.
So suffering is one aspect, but also if you're looking at it from an economic point of view, there's been research that has demonstrated that the cost that mental health conditions have on society is enormous. So if you're able to address and treat mental health problems, it also pays back, and almost to a 1.4 ratio. So every dollar invested in mental health has a return of investment of $4 in the long term. So there's also an economic argument to be made for investing in people's mental health and children's mental health specifically.
What is one way to scale the Team Up intervention tool?
There is a scarcity of mental health professionals. So there's very few psychologists or trained social workers, and yet the need is even larger. And so one way to address that problem is through something that we call task shifting or task sharing. And essentially that means that you're training non-specialists to take on the role and take on activities that might be reserved for mental health professionals in our context. So that means that you are training people that have no formal background or mental health training into delivering this intervention.
Team Up is not War Child's only intervention.
If you think of the complexity of how conflict and war addresses the mental health and well-being of children, you can imagine that one single intervention can never address all of these needs and problems of children. But it's not enough for children that are really facing more severe mental health problems, for example. It will not be enough to really reduce risks of child abuse. It will not be enough to improve the education context. So what we are saying is you will always need a combination of interventions, and that's what we call a system of care, to address the different pathways by which conflict affects children. Then there is that 20% of children that have more severe depression, for example, or maybe post-traumatic stress disorder or suicidal complaints. For that group, Team Up is not enough. So what we have done, for example, is developed a very simple tool by which teachers or Team Up facilitators can detect children that need more mental health care. So it's a very simple one-page tool that consists of vignettes and a few illustrations and 3 simple questions that allow community gatekeepers, such as teachers, to detect children that are in need of mental health care. Once these children are detected, they can be referred on and they can be encouraged to take up the next level of care. And that's basically an intervention that really does address the more severe emotional distress that children are facing, such as depression or anxiety. So this is an intervention that is called EASE, Early Adolescent Skills for Emotion. It's an intervention that is developed by the World Health Organization and that we collaborated on with the WHO on evaluating in Lebanon and in Jordan in order to demonstrate that it's effective in actually reducing those more severe mental health needs. But if they then go home to a context where the parents are very distressed, the parents are themselves dealing with the consequences of the adversity and conflict, then they're bound to relapse, to experience distress as a result of that home context. So we also need to work with the parents and the caregivers. So for that, we have developed an intervention called Be There that really works with the caregivers of children to support their well-being and to support their parenting practices. So really, we have interventions that address those child protection issues at the community level, or improve access to education, or the well-being of teachers. And all of these interventions together offer a package that really tries to improve the well-being of children, more systemically.
Places where children are suffering today desperately need interventions like Team Up, Ease, and Be There, says Dr. Jordans.
Places like Ukraine and Gaza, as well as any of the other active conflict settings, is exactly where this type of intervention, such as Team Up, but also the other ones, are very, very relevant. In fact, in Gaza, we were implementing Team Up before it became impossible to do anything in that context. But as soon as it is possible again, we will certainly implement interventions such as Team Up. But this is also where we get back to the point that Team Up alone is not enough. Sure, it will be important to engage children again in positive activity. It will be important to create some sense of normality. It will be important to give some sense of structure again to children. All of these things that children, I think, receive by participating in Team Up. They learn to regulate their emotion, to reduce and deal with levels of stress. So all of that is extremely relevant in a situation such as Ukraine or Gaza. But it will not be enough, and that is why we will need to also be able to use a tool such as the detection tool to identify what children need more care, and to be able to offer that additional care, such as ease or other interventions to really reduce the more severe suffering. And there will be many other needs that will need to be met at the same time. And that's back to my point saying, like, we need to think of it as a system of care rather than kind of individual solutions.
Dr. Jordan's work with War Child is part of his lifelong interest in the health and well-being of children, a passion that was inspired by his own father's work.
My childhood, I have been very, very lucky to have been brought up in a very secure, loving, and a very healthy setting, and inspired also by a father who was a doctor working in situations of the Ethiopian famine and the earthquake in India. So on a very early age, I was experiencing my father's involvement in kind of humanitarian work as a doctor. He was a GP, he was a family doctor who worked with Doctors Without Borders and other organizations to really be a frontline physician. And that involved being in one of the, or some of the most difficult humanitarian contexts, such as Liberia and the Ethiopian famine back a couple of decades ago, where he was responsible for setting up kind of the medical support systems. And that I remember vividly, that involved having to decide who and thousands of people would get food that day and who didn't, and doing basic operations, just, really life-saving work. So yeah, very, very inspiring.
Every child everywhere deserves the safety and opportunity Dr. Jordans was privileged with, and they deserve the peace in which he raised his own son. War is a man-made disaster, and inflicting violence on children is a choice.
The passion for working for children has always been there, but definitely got stronger by becoming a father. I cannot get my head around the stupidity of war, and that we are still, in this day and age, waging war. If by the end of my professional life, I could see that there is more systematic, more large-scale attention to addressing the well-being of children, especially in children that need it the most, I would be very happy. And with that, I mean that it's systematic, that governments adopt it, that it's really implemented at large scale, that there's no, piecemeal approach of a little project here and another little project there, but it's actually done systematically, that there is school-based mental health services available, that when schools are not there, that there is online or digital education solutions being offered to children, that communities are really empowered to deal with child protection needs of children. So really that there's systematic and systemic answers to some of the biggest problems that children are facing with. That I would like to see, rather than this piecemeal approach that we're seeing now. And then that we are, as a sector, embracing an evidence-based approach. We can no longer say that we are working based on intuition or based on bad monitoring and evaluation data. We need to have, and we owe it to the children, to have rigorous and solid evidence for the effectiveness of the work that we're offering. So I really would hope that that would also be embraced by the whole sector and in some time sooner rather than later, I hope.
Is he optimistic?
I'm optimistic on two parts. I'm optimistic about the fact that mental health is getting more and more attention. We came from a place where it got very little attention and there was very little consensus around how to implement mental health and psychosocial support. So that I'm optimistic about the attention. I'm also optimistic about the solutions that have been developed over the years and the evidence for those solutions. Again, in mental health solutions, but equally in child protection and education. There's more and more solutions that have been developed and tested, and we know that they can work, even when implemented by non-specialists. So I'm optimistic on those sides. I'm a little bit more skeptical, not skeptical, but I think there's a lot more to be done still on the funding side. I think there's very few governments, very few philanthropic organizations or other donors that are willing to really invest big bucks into mental health. And whether that's the type of interventions that I mentioned or other work that is also going on about integrating mental health into primary healthcare settings or dealing with severe mental health problems. Whatever it is, I think there's still a lack of serious investment and funding being made available.
I'm grateful for the commitment and expertise of researchers like Dr. Mark Jordan's, who are devoted to caring for children who need and deserve everything. If you're moved by this story, you can donate to War Child's work at warchild.net. And while we should urge our elected officials to end wars and conflicts, we can also push our governments to invest in mental health care treatments for those millions of people who have been impacted by violence. And we can work for peace, understanding, and reconciliation in our own communities and nations. If you enjoy the stories we share with you on the podcast, please follow us, give us a 5-star rating and a review, and share this podcast with one friend who might be inspired or educated by it. Please be sure to sign up for the TWCF newsletter at templetonworldcharity.org. You can find Stories of Impact on Twitter, Instagram, and Facebook, and at storiesofimpact.org. This has been the Stories of Impact podcast with interviews by Richard Sergey and Tavia Gilbert. Written and produced by Tavia Gilbert for Talkbox Productions. Senior producer, Katie Flood. Assistant producer, Oscar Falk. Production support by Mandy Moorish. Music by Alexander Filipiak. Mix and master by Kayla Elrod. Executive producer, Michelle Cobb. The Stories of Impact podcast is generously supported by Templeton World Charity Foundation.